Good morning. Welcome to our DMU event. And thank you very much for your interest in the MSc in Health Psychology. So I'm going to spend a bit of time. I'll introduce myself and the programme, tell you a little bit more about the modules and what we cover in the course. And you're more than welcome to ask questions, so you can add those to the chat box. So my name's Lindsay Apps. I'm the programme lead for the Masters in Health Psychology at De University. I am also a practitioner health psychologist. So I have gone through that qualification route as well, and I have worked in the NHS as a practitioner health psychologist for a number of years before I came to De University. I worked with patients who had respiratory conditions largely, but I worked also in applied research looking at interventions for those with chronic health conditions. So I'm now programme lead of the Masters in Health Psychology, and this is a BPS accredited programme. So it is accredited by the British Psychological Society, and therefore it does qualify as stage 1 training if you are interested in and then eligible to go on to pursue further training in health psychology in terms of the stage 2 practitioner status. So in terms of what is health psychology first, just to give a bit of background to that. So health psychology focuses on those processes that underlie health, illness, healthcare, and it can be applied in areas concerned with the promotion and maintenance of health. So we could be looking at behaviours that are detrimental to health or behaviours that enhance our health. So for example, looking at behaviours such as exercise, smoking, condom use, eating behaviours. So there's a whole range of those health behaviours. It's also applied in areas of illness prevention. So that is looking at health and disease screening, for example, improving health for those who live with an illness. So that can be in the areas of chronic illness, so long-term health conditions. That could be looking at things such as disease acceptance, how people cope with living with a health condition. That could be at the beginning, it could be throughout the course, so again across the lifespan, and also looking at self-management, so strategies, interventions, what we understand about that. And it can also be implied in the area of how healthcare systems are delivered and health policy. So it's a very broad aspects of health, but very much looking at the biopsychosocial understanding of those as opposed to a purely medical view of those aspects of health. I have a couple of slides which will help summarise the ways that you can study this programme. So there's a first slide that hopefully should come up. Excellent, thank you. So again, just to remind you, this is a BPS accredited programme, and the way it is delivered is across 6 15-credit modules. So that's very much those taught academic models that will provide you the foundations of the understanding of some of those areas that I've mentioned in health psychology, and I will go on to talk more about those. You also do a larger 30-credit module on research methods, so that includes quantitative and qualitative research methods, as well as mixed methods. And then there's a larger 60-credit module, which is your dissertation. So you can study this course for 12 months full-time, but there are also part-time options available. These can be taken over 2 years or 3 years. In terms of your attendance, so time on campus or time in sessions, depending on how we're delivering, you can expect to be attending classes up to 3 days a week. So classes may be spread across up to 3 days a week. And typically you may be looking at approximately 10 hours a week. But again, how that spread can vary. There are also other awards available. So if you don't want to go on and study the full masters, you can take 90 credits, which would give you a postgraduate certificate, and 120 credits, which would be all of the modules except the dissertation component, and that would give you the postgraduate diploma for those 120 credits. So I mentioned those modules. So I've just got a quick slide here where you can see the modules that you study, and again, feel free to ask questions about any of these. So those first 6 there are the 15 credit modules that I mentioned. So we look at theories and perspectives in health psychology. So that's a lot of the initial theory and models that are very relevant to health psychology. We have modules that focus on mind, body and health, focus on chronic conditions, also a focus on the critical and international perspectives in health psychology, and then a focus on food across the lifespan, and then health psychology in theory and contemporary practice. So looking a lot more at the applied elements. And then, like I said, there's also research methods and data analysis, so grounding in all of qualitative, quantitative and mixed methods. And then you have the opportunity to carry out your own piece of research under supervision, which is your dissertation. So that's a quick overview of those module titles. In terms of what that means in terms of your content, you'll look at those biopsychosocial models. So it's focusing on the biological, the psychological and the social aspects of health and healthcare. And that initial module gives you a grounding in those models and the other social cognition models that are relevant to health behaviours and health outcomes. You'll also look at the role of those different behaviours in relation to our health and well-being. So the role of those health-enhancing behaviours that I mentioned and health-compromising, so the behaviours that can be detrimental to our health. You'll also, in one of those modules, spend some time looking at the impact of long-term health conditions. That includes looking at adherence as well in relation to those conditions. Also, there's a module that focuses on how mind-body interactions can influence our health. So, for example, looking at stress is one relevant factor in that module. And then there's also a module that looks at eating behaviours, and that goes across the lifespan. As I said, there's also the critical and international module. So that's looking at health and illness in disadvantaged communities, and you get the opportunity to do an assignment that focuses a lot more on that. And then in that final module, in terms of the taught 15 credit modules that I mentioned, that's really starting to look at all those theories that you've spent a good chunk of the year learning, how we apply those in practice, and looking at other relevant factors when we start looking at interdisciplinary working. So how different healthcare professionals work together to achieve the same patient goals, for example, or client goals. In research methods, you get the opportunity to acquire that further depth in how we collect, analyse and present research data. And like I said, that includes quantitative, qualitative and mixed methods. And then with your dissertation, you'll have a supervisor and you'll have the opportunity to carry out an independent piece of research in a health-related area. And again, your supervisor would be someone from the health psychology teaching team. As part of the programme, it's actually as part of that final module that's taught that I mentioned, so health psychology in theory and contemporary practice, that's actually a module that I lead. And as part of that, you also have some interprofessional education events. So these may occur on non-teaching days. They form part of one of the weeks of that module. And this is to provide a particular focus on interprofessional education, so learning alongside others. And that can include learning alongside others that come from different psychology backgrounds or different healthcare disciplines. And it's that opportunity to really take an in-depth focus on areas of healthcare. We may focus on a particular patient case study, look at aspects of healthcare delivery, how patients and professionals interact, how different professionals can interact with each other. So how those interdisciplinary teams work together. And we really take that interdisciplinary lens with those events. So it's an opportunity to absorb yourselves a little bit more in that and look at those different roles and perspectives that can go across the healthcare journey. So that can be across professions, as well as patients or clients and their families and significant others that may be relevant to that healthcare environment. So that's very much an overview of the content, some of the things that you'll be doing across those modules. We also have a wide variety of assessments. So At the beginning of the programme, we do have a more traditional essay and exam as part of one of the modules, but then you'll see a lot more variety in the type of assessments that you do. So there'll be research reports alongside research methods, and obviously that forms a big part of your dissertation module as well, because you'll be writing that up as a formal report. But there's also the opportunity to do an oral presentation, a critical review, another assignment that's focused on blog entries. You'll do a consultancy report, a systematic review. So that's not all of them, but that gives you an idea of the range of assessments that you have. In terms of careers and employability, as I said, for those of you who are eligible and interested, the MSc does form stage 1. It is BPS accredited, so you'd be in a position to apply for stage 2 health psychology training if that was your career aspiration. But also for those of you that aren't eligible or aren't interested in immediately going on to further study, there can be a host of opportunities across multiple sectors where that specialist knowledge around health and the psychosocial understandings of health can be really relevant. So we do host later on towards the end of the teaching weeks, so much towards the end of term 2 on the master's programme, we put on an employability event as well. And that's where you'll get introduced to a lot, so understand a little bit more about health psychology training, but also understand some other careers that may be relevant to people who are coming towards the end of a master's, a little bit more focus on those transferable skills. We also have a careers focused session as part of the module that I lead that I mentioned. And again, we explore those, and that can be very individual to the group based on what is the makeup of that particular group. Have we got lots of people who want to go on to stage 2? Have we got people considering other professions as well? So that career session and the opportunity for you to have that interaction is there as well. You also have the opportunity to discuss your career aspirations with any of us in the teaching team, but also as part of tutorials that you'll have an assigned personal tutor during the programme, and you have the opportunity to discuss those with them as well. And then there's the wider university career service as well. So that's an opportunity to get support around building your CV. You may be interested in finding out about volunteering opportunities, that sort of thing as well. So you have opportunities to talk about your careers with the wider university career service, but also with us as a health psychology team as well. And as you go through your studies, there's also additional support provided through the library. So this can be support if you need to access certain software. So for example, SPSS is commonly used in psychology. If you want to have that downloaded onto your computer, you can pick up information from that so that you can practice and use SPSS outside of your sessions, and that can be really useful for students. And there's a lot of study skills related sessions provided through the library via the class service, and that can include essay writing skills, time management, stress management, exam preparation, all those sorts of things as well. So you have access to all of that, and you'll be given all of that information when you're with us as well. I have talked an awful lot about the programme, so that's quite a lot to take through. I don't know if this is a good opportunity to see if we've had any questions come through. I'm more than happy to ask any questions about anything I've said or anything I may not have said that you'd want to know a little bit more about. Okay, so in terms of applications, so applications are still open, and we have had a lot of interest for the next academic year. So it is likely that as we get through the summer, we will set a deadline for applications, and this is likely to be sometime in August, but this date's yet to be confirmed. So please do keep an eye out on our keep in contact, with admissions to see once that date is set. But really, if you think you're interested in this programme, is it possibly to get your applications in earlier in the summer to avoid missing that date, likely to be sometime in August when we may close applications. Okay, yes, so I alluded to the different job roles. So again, this can be quite varied. It may depend on what your undergraduate background was and any previous experience you've had prior to the MSc. For those who have the relevant psychology prerequisites, they can go on to stage 2 health psychology training, as I've said. Some people also find this is a good foundation and they go on and pursue clinical psychology training as well. For those who don't want to pursue that level of study immediately or at all, or maybe don't have that previous psychology background, there can be lots of health opportunities across the charity sector, public health, and local councils. So the kind of roles that people may start looking at and where you may see some of the skills and knowledge that you have following the health psychology masters that you see on those job descriptions could be around smoking cessation, other health and lifestyle support initiatives or programs. So again, that could be set within charities. So for example, cancer research charities or charities relating to specific long-term health conditions, could be around smoking cessation services, physical activity support, so that could be within local councils as well, health promotion, project management in health related areas again, so those sort of more project management roles. It's about, we talk about this a lot in the module that you do with myself about those transferable skills. But any roles that are really looking for you to have that more broader understanding of health and the determinants of health, we often find are really good experiences, whether you want to go on and pursue further training or not. And we do have some students that are interested in the more academic careers, and so may look to apply for PhD funding or PhD studentships as well. So we've got a question: do we have class presentation for MSc psychology? So is that assuming in terms of assessments? We do have one module where you do a oral presentation. That's in the critical and international perspectives module, where you do you're set a broad topic and you can choose a particular theme to focus on, a more specific focus, and you do an oral presentation to a panel, including some of your peers during the programme. Okay, so I'm not the programme lead for MSc Psychological Wellbeing, so I can only comment more broadly, but by all means do get in touch with marketing to get more information about the differences between the programmes, and you can see that on our websites as well. But psychological wellbeing is going to be more focused on that those broader concepts of psychological wellbeing and the factors and the determinants of it, whereas MSc Health Psychology is an accredited programme and is a lot more just focused on that discipline, rather than those broader wellbeing concepts. Do you need work experience to apply? So you don't need specific work experience to apply. The MSc in Health Psychology is the academic component, so it's there to provide you with that academic basis to health psychology. And then if you went on to further training in health psychology, that is where you would then build on that knowledge and the theoretical basis and be taking part in supervised practice and those components that are asking you more to apply those. But you don't need specific work experience to apply. If you're coming from a non-psychology background, then as part of your application, you may be asked if you have that knowledge or experience in a health-related area, but otherwise, no. Do we study all modules across the year? So yes, if you are studying with us full time, then you will study all of those modules across the year. So that starts early October and finishes with your final dissertation submission, your final dissertation report in early September, with your grades and awards being confirmed and ratified around about November. So teaching generally runs from early October to around about Easter time, either just after Easter or just before, depending on where Easter falls. But then you continue to have tutorials and contact with us, mainly with your dissertation supervisor at that point, because then from when teaching ends, you have some final few assessments from those final modules, and then you're really spending the summer focusing on your dissertation, ready to write up and hand in early September. But you still have contact with your dissertation supervisor, your personal tutor, and staff that you need to contact over that period as well. If you are part-time, then the schedule would be different, because you'd be spreading that over 2 or 3 years. If you were to take the 3-year option, for example, you'd find that third year would be largely focused on the dissertation, with you taking the bulk of the modules over year 1 and year 2. And again, slightly different split. If you were doing it part-time over 2 years, you would be spreading. So you do some of the modules in year 1, some of them in year 2. We would structure them accordingly so that you're getting those foundational theoretical modules earlier on, because they form the basis of some of the later modules that you do. Okay, so in the current situation, how the class is going to be. Okay, so as I'm sure you can appreciate, we are slightly subject to how the COVID situation evolves and the government measures that are put in place. At the moment, we are planning for a lot more face-to-face contact, but it's hard to comment at the moment exactly what format that would take, because we are slightly subject to the guidelines and what the guidelines will be come October. But we are very hopeful for a much more blended approach with more face-to-face. But absolutely do stay in touch with us in the admissions team, and then those other contact emails that you've got, so that we can advise more on that as the situation with COVID progresses and we know more about when restrictions are going to end. Okay. So do any other questions from what I've said, or maybe particular burning things that I might not have commented on that would be really useful to know? Okay. So if you've got any more questions, feel free to pop them in the chat now. We can answer them before the session finishes. Okay, so I don't think there's any more questions coming through. So hopefully you found that really useful. You are more than free to send through more questions to us, depending on the question. Send them through to admissions and marketing. Yeah, they can distribute questions to us depending on the nature of the query. But thank you very much for joining us this morning. Thanks for listening, and thank you for asking your questions. And we'll look forward to seeing and speaking to you again next term if you end up coming to us. Thank you very much.